Hello, welcome to the video on common routes of drug administration and the common drugs used in sedation. In this lesson, we will be discussing routes of drug administration. Additionally, we will also delve into some pharmacology of common drugs used in sedation. This portion will be a little long and dry, so I will not be going into all the details, but please feel free to pause the video at certain points to read more about each drug. The common routes of sedation drug administration are as follows. Inhalational, where the agent is inhaled and absorbed via the lungs. This is usually fast and short-acting. It also allows a titration of drug administered, meaning the level of sedation can be adjusted. Oral, where the agent is swallowed and absorbed via the GI tract. This route is usually more acceptable to young children, but suffers from the first-pass effect. Redosing in the event of the patient spitting out the medication can also be an issue. The other routes are parental in nature. Of these, the sublingual and intramuscular route requires injection and may be difficult in an uncooperative patient. The intranasal route is often used in young children and can be easier to administer than an injection. However, only a small amount can be delivered, and some of the drugs used can burn and is uncomfortable. The intravascular route has the advantage of continuous access, allowing for titration and also the administration of rescue drugs if required. However, it can be difficult to place in uncooperative patients. Here are some common drugs used to provide sedation in pediatric patients. The list is not exhaustive, and you should always read up on the agent you plan to use. Nitrous oxide is an inhalational gas used frequently in the dental setting, as well as general anesthesia induction. It is generally very safe and has a very fast onset and short duration. It can be administered via nasal hoods in anxious dental patients. However, this should be used in conjunction with other behavioral management techniques. It will not work in pre-cooperative or uncooperative children as they have to breathe in the nitrous oxide for it to work. Hydroxyzine is an antihistamine that is taken orally. It is usually used to provide anxiolysis, but can be used in combination with other agents to provide moderate sedation. Benzodiazepines are also commonly used for sedation. The short-acting midazolam is the preferred choice in pediatric patients and can be given via oral, intranasal, or intravascular routes. One of the biggest advantages is anterograde amnesia, which means that even if you have to restrain a child for administration, they may not remember it. Diazepam is a long-acting benzodiazepine that is more commonly used in adults as an anxiolytic. Ketamine is a procedure anesthetic that is commonly used in pediatric emergencies. It is also a common animal tranquilizer that results in a sedated patient that does not move. It is commonly used for short procedures requiring immobility, such as the suturing of head lacerations. Meperidine is an opioid sometimes used in pediatric sedation. Opioids provide a euphoria and also analgesic effects, which can be very helpful in painful procedures. One should be cautious when using opioids in pediatric sedation, as they can result in respiratory depression. This is particularly pronounced in stronger opioids such as fentanyl. To recap, we have learned about various routes of drug administration for sedation. The common drugs listed here are not exhaustive, and you should be familiar with the pharmacology of the drugs you use. Hello, welcome to the video on sedation monitoring and adverse events. In this lesson, we will be discussing monitoring for patients under sedation. Additionally, we will also discuss some of the common adverse events related to sedation and how to manage them. It is important to monitor patients as they may go into deeper states of sedation and have decreased protective reflexes. The most important monitor is you. Keeping an eye on the patient's coloration, looking at chest rise, monitoring response is paramount. However, sometimes you may be consumed by the procedure you are performing and will require a second monitor. This person should just be observing the patient and looking at the monitors without any other responsibilities. There is various equipment that can aid in monitoring the patient, but does not replace an alert and focused person. Equipment such as the precordial stethoscope is placed over the trachea and allows for the monitoring of breath sounds. However, this can sometimes dislodge and can also be difficult to hear over loud sounds such as a dental drill. The pulse oximeter has a clip that can easily be placed on a patient's finger. This measures the oxygen saturation level of the blood and is an indirect measure of continued respiration. However, the accuracy can be affected if the patient moves and dislodges the clip, if the room is too cold and blood flow is decreased to the limbs, or even if a blood pressure cuff is placed on the same arm. Additionally, since it is an indirect measure, the response to apnea is delayed due to the sigmoidal characteristics of the hemoglobin-oxygen dissociation curve. The saturation level only drops at low oxygen levels and will fall very rapidly, meaning that you will have very little time to react. For a direct and more responsive measure of respiration, the capnograph may be used. The capnograph measures the amount of CO2 released from the lungs. This is a direct and more responsive measure of respiration. However, this requires the placement of a nasal cannula and may not be accurate if the patient is mouth-breathing or if the cannula is blocked up by mucus. The ECG records the electric activity of the heart. However, advanced training is required to read this adequately. Now let us talk about some common adverse events during pediatric sedation. Respiratory events are some of the most common adverse events that can occur during sedation of pediatric patients, of which respiratory arrest and depression constitutes more than 70%. This is due to differences in the airway from adults, with children having increased resistance, larger tongue and lymphoid tissues, and smaller mandibles, all resulting in a smaller airway. Decreased respiratory drive from sedation agents can result in a patient having a respiratory event. In such an event, it is important to first recognize it from signs such as decreased chest rise, cyanosis of the lip and fingers, decreased response from the patient, and decreased pulse ox and capnography readings. When encountering this, first stop all procedures. Remove any instruments you may have in the mouth or nose and open the airway via the head tilt chin lift maneuver. Stimulate the patient to try to wake the patient, perhaps with a trapezius squeeze or sternal rub. If the respiratory rate does not recover, supplement with oxygen or support the breathing with a back valve mask. At this point, additional medical support may be required and help should be called. Additionally, it may be necessary to use reversal agents to decrease the level of sedation and respiratory depression. Naloxone is the reversal agent for opioids, and fumazanil is the reversal agent for benzodiazepines such as midazolam. The most severe form of allergic reaction is known as anaphylaxis. This is a life-threatening situation requiring immediate care. Symptoms include generalized hives, angioedema, shortness of breath and wheezing, increased heart rate with decreased pressure. Activating a response team when recognizing anaphylaxis can aid in the management. The administering of epinephrine is the primary treatment. This can be drawn and given intramuscularly or given using an auto-injector such as an EpiPen. Additionally, airway management with supplemental oxygen and IV fluids and antihistamines may be required to support the patient. In many cases, prevention means the avoidance of allergy, and a good history taking can help with that. To recap, we have learned about the importance of monitoring during sedation and the recognition and management of some of the more common adverse events.